Fox 17 News at 10 starts right now.
People across the country to right here in West Michigan are monitoring how a huge tax bill in Washington could impact their Medicaid coverage. The legislation, called the One Big Beautiful Bill Act, is working its way through Congress, with House Republicans hoping to pass it by the end of the week. Fox News' Connor Hansen has the latest on negotiations.
We're excited. I believe we are going to land this airplane.
Coming from a meeting at the White House, Speaker Mike Johnson expressed optimism about passing the president's key piece of legislation. In the meeting with President Trump were several members of the conservative Freedom Caucus who have wanted to see deeper cuts. It appears the added pressure from the president might have helped.
The meeting in the White House went well. I think we made some progress, and it's in process.
A written statement from the White House read, quote, "President Trump is committed to keeping his promises, and failure to pass this bill would be the ultimate betrayal." A deal had already been made, with Republicans wanting to raise the cap on state and local tax deductions. The powerful House Rules Committee could add Speaker Johnson's final changes, which might include last-minute sweeteners for some of the last holdouts.
We're going to keep moving this process forward and get this bill over to the Senate.
Republicans could only afford to have 3 of their members vote no. President Trump has said he does not want to see cuts to Medicaid, but Democrats united against the bill say millions will lose insurance under the program.
This bill hurts American families. They're the losers of this bill.
One reason for the rush to vote is that Republicans could start losing numbers as members leave town ahead of the holiday weekend. In New York, Connor Hansen, Fox News.
Again, changes to Medicaid are proposed in this bill. Before we get to what those are, let's review what Medicaid is. According to the state, Medicaid covers 1 in 4 Michiganders. That's about 2.8 million people statewide. The state defines Medicaid as a health care program that provides comprehensive medical services to low-income adults and children. Services covered by Medicaid are offered through what's called fee-for-service, where providers are paid for each service they perform, or through Medicaid health plans. Now, a focus of the bill is Medicaid and what's called community engagement requirements. That last part is the kicker of all of this. The new requirement would force recipients to work, volunteer, or educate themselves for a minimum amount of time per month. Specifically, at least 80 hours for able-bodied adults without dependents. Medicaid recipients would have to verify with the federal government twice a year rather than just once. According to an estimate from the Congressional Budget Office, proposed changes to Medicaid would reduce the number of people with health care by at least 7.6 million. Now, in a closed-door meeting, Trump is reported to have told Republicans in a manner of words to not mess around with Medicaid funding while supporting these changes. Republicans are looking to generate federal savings with the new work requirements, but Democrats argue millions of Americans will lose coverage. I talked with Congressman Bill Huizenga, who represents Michigan's 4th District. He emphasized the need to ensure benefits go to U.S. citizens in need and not to those who are illegally enrolled, including those in the country illegally.
I truly believe that if you are if you're able-bodied, you should be back to work. If not, then this is the program that can be there for you. There was over $500 billion in waste, fraud, and abuse throughout this system. It's massive. So we've got to go in and make sure and verify that those who are on the system truly need the system, and we can strengthen it for those folks who need it.
A lot of good working people are going to be impacted because of the administrative burden. And again, most people on Medicaid are already working. So I think it's a fallacy that we're going to only impact a group of people that are taking advantage of the system when only 6% of people on Medicaid are unemployed out of that adult population.
Megan Erskine is the CEO of Catherine's Health Center. During my conversation with her, she emphasized that most Medicaid recipients are already working and that the reforms could lead to collateral damage, including the 212,000 Kent County residents on Medicaid. If the current proposal is approved, the new requirements would not kick in until 2029. That's after Trump leaves office. If Democrats were to remain totally opposed, Republicans can only afford to have 3 members